Hello, welcome to lesson number 4. Lesson 4 talks about and introduces medication adherence or compliance, which is this idea of when any patient, regardless of age, is prescribed a medication or we use a medication that's over the counter, do we actually take the medication as prescribed, as directed by the doctor's orders? And if we don't take the medication as prescribed by the doctor's orders, why not? What's some of the reasons behind that? And what can we do as medical professionals or human service professionals, as parents, friends, family members, to help our patients and loved ones to take their medicine as directed? Because a major issue with especially the older adult population is unintentional misuse of medication. And this is what we mean by unintentional misuse. The unintentional misuse can include skipping dosages, taking it every other day, maybe taking too much of a particular medication than is intended. Many times we hear justifications of saying, or patients saying, well, I can't afford to take it as the doctor prescribes, so I only take it every other day. It'll help me the same. And generally speaking, that's not true. Or sometimes patients may tell us, well, the doctor says to take one when I'm in pain, but I'm in a lot of pain right now, so I'll take 3 instead. That will really help. And that's another issue with medication compliance, that more is seldom better, especially long term. So our book begins talking about this concept. I've included 5 really good journal articles that talks about why more is not better. It starts talking about why we as patients and older adults don't take our medicine like we're supposed to. It gives us some suggestions in terms of how to talk with patients and older adults about the importance of taking medicine like we're supposed to. The readings discuss simple things that we can do, such as pill charts or pill boxes that dramatically increases the likelihood of patients taking medicine like they're supposed to. Because in general, for a patient over 60, many patients take over 11 different types of medication. That includes prescription and over-the-counter. So you can imagine the difficulties of trying to manage the various schedules of when I'm supposed to take a certain medicine, and at what time on certain days, and what order am I supposed to eat with this medicine but not eat with this medicine, and so forth. And it truly becomes a full-time job. And frequently we don't think about the challenges that's associated with this, but with having so many medicines that folks have to manage. Then when you add in short-term memory loss or other cognitive deficits, difficulty with seeing, difficulty with being able to use your hands to not only open the bottles, but pick up the small individual pills, the picture becomes much more challenging. Our tip reading, Chapter 3 tip reading from the Treatment Improvement Protocol, also discusses this topic. We have a discussion board related to your prior experiences with families, with older adults in medication maintenance, or community members. Plus we have our first 2-page paper, minimum of 2 pages, no more than 3 pages, which asks you to report back to me about what you learned from the journal articles, about why we have such medication compliance issues with older adults, and what some of the recommended best practices are to help our older adults take their medicine like they're supposed to take them. And what I will do with your papers after the due date, I will review everybody's papers within 7 days, make personal notes on the papers for each individual student, add the grading rubric to the paper. I will then scan the paper and email the paper back to you, so you will have individual feedback about your content and your APA formatting and the actual rubric I used, so you kind of know what I've been thinking about and how I graded the paper. In the meantime, please let me know if you have any questions. And I really enjoyed the discussion board postings for the last lesson. They were very insightful, and most of us participated extremely well and made some really good points. Let me know if you need help. Thanks.